One of the reasons that I have a concierge family practice is to provide an environment where people feel safe and comfortable coming to. Fear is something that is a very unnatural emotion, except for two things: the fear of falling and the fear of loud noises. Both of those things help us prevent bad things from happening to us. Pretty much every other fear starts between our two ears in our mind and is not justified. The largest unjustified thought about coming to see a physician is, what will the doctor say to me? I don't want to hear bad news. I'll feel embarrassed describing my problem. I'd like to specify that when patients bring news into the doctor's office, it's likely been heard many, many times before, and the physician will not likely think personally about that problem because of the way we're trained. If we don't have a safe space where people can feel comfortable talking about their issues, then we would not be around. The purpose of our practice is to provide that space. Not only is that information necessary, despite how embarrassing it might be, it's the only way that we can actually help. And without that trust, the patient won't feel comfortable expressing themselves. And without the trust of the patient for the physician, we can't give the appropriate advice. Our advice should be given in a non-judgmental, matter-of-fact way, permitting the patient to have choices on how they wish to proceed. And that choice may not be the exact instructions that the physician wants to give, but at least get the patient going in the right direction. When we start seeing patients in my practice, we get to know them at a first visit, going over their history. Eventually, we'll get to a preventative visit. Until we get to that preventative visit, the patient gets to know the way that we're going to be approaching things. And it's not looking for the worst thing first, it's looking at the entire patient, finding out what their concerns and fears are, judging objectively whether anything else could be going on, and then explaining to the patient how either their concern is justified and this is what we're going to do to deal with it, or if you're concerned about this, let's make sure this is not occurring, because I don't think it is, but we're going to go down this path and get a test to confirm that, and it's all right to do that test if we can give you peace of mind. A test, an evaluation, is either to uncover a problem or to confirm that a problem is not occurring. Both are equally important and give us peace of mind.